However, we highly appreciate the opportunity to present our work remotely. If you have any question during the presentation, please email us. We are going to provide the email addresses at the end of the presentation. We are going to present a framework for designing a healthy lifestyle management information system, which has been created by myself, Megha, taimur, and Dr. Sandeep Chatterjee. Here is the agenda for our presentation. We are going to provide an introduction. After that, we'll talk about theoretical background, and then we'll talk about related studies, and then we'll talk about a framework for healthy lifestyle management information system called HLMIS, and then we'll give an example of an HLMIS. After that, we'll talk about key challenges that are associated with the development of such HLMIS, and then we'll conclude our presentation. The healthcare industry in the United States is facing major challenges in terms of financial and human resources. In 2003, 15.3% of GDP was spent on healthcare, which is higher than healthcare spending of any other developed country. And still, it has been projected to rise 18.7% in the next decade. We have increasing older population, which obviously requires frequent healthcare, as they are more likely to suffer from chronic diseases. The country is also facing shortage of physicians and nurses. Now, the key solution for this is to prevent diseases or prevent illness, which everyone talks, including healthcare provider and all the researchers. But how do we do that? Well, that requires people to adhere to a healthy lifestyle. The question is, how do we make people to adhere to a healthy lifestyle? One of the promising areas for it is to integrating evidence-based principles of psychology and harnessing IT, and our framework is based on that. Let's talk about similar or like systems. Healthy lifestyle domains. There are different domains. What is healthy lifestyle? Well, it requires people to stop smoking, to prevent obesity, prevent or control chronic diseases, do stress management. Well, there are many commercial and non-commercial internet interventions available. Just a few name, weightwatchers.com, Calorie King, and so many others. Well, they do not work and as much as they should, and we all know about it. The thing is, they lack the holistic view that incorporates principles of human psychology as well as technology. It has been presented here. In 1998, Centers for Disease Control and American Psychological Association co-sponsored the National Conference on Integrating Behavioral and Social Science in the area of public health, and the major finding from this conference was the notion of ecological model. The model says health is affected by a dynamic interaction among biology, behavior, and the environment, and this interaction changes over the life course. We have built our framework by integrating these three domains: biology, behavior, and environment. You can see it when we describe the framework. I'll talk a bit on behavior change domain. There is vast literature available on it. But to concise it, we mentioned the main behavior change theories recognized by a theorist workshop which was held by NIH in 1991. These theories are the health belief model, the social cognitive theory, the theory of reason action, the theory of self-regulation and self-control, the theory of subjective culture and interpersonal relations. When all five theories and their variables are combined, consensus was reached on 8 key factors mentioned here. They are intentions, environmental barriers, skills, outcome expectancies, social norms, self-standards, emotional reactions, and self-efficacy.
We must also capture data about any chronic conditions to reduce the chances of the system interacting with the participant in a harmful manner. The second step in the HLMIS development is the creation of a data repository, such as a database, for storing the acquired consumer information. The repository needs to be able to store a large volume of data for every individual participant and respond to queries as well. The HLMIS repository could be built from ground up, or it could be connecting to existing repositories. Alright, the first step in developing an HLMIS is the acquisition of consumer health data, and this could be through existing electronic health records, or it could be through a questionnaire or even biosensors. The characteristics of the health data acquired depend upon the application domain. So, for example, if the system is geared towards healthy weight management, the messages will also be relevant to the user context and interactive, allowing feedback and progress tracking towards goals. Desired channels of communication such as email, SMS, phone can be selected by a user and stored in his or her profile. Since the HLMIS is an interactive system, it will be able to store user response as well as contextual information at the response time for later updates to the system to adapt. Okay, an example scenario could be a participant responding to a message that asks the user to respond with calories of food eaten during lunch. We consider our system as a disease prevention program as well as an information system. It aims to help people avoid deadly diseases such as diabetes and heart conditions. It does it as an interactive communication system, educating people about their options. Like any disease prevention program, it can be evaluated for effectiveness based on certain criteria. The evaluation will not only deal with the program, but with the information system as well. And the feedback will be used to update the system as well as the program. The use of our framework is illustrated in an example of an HLMIS currently being tested and developed in the Network Convergence Lab at Claremont Graduate University. Okay. Our HLMIS achieves the first step through a web-based portal. The questionnaire covers domain knowledge as well as lifestyle information, and it will be stored in a SQL database. Our weight management domain questionnaire is developed with the help of Kaiser Permanente and Our weight management domain questionnaire was held. Our weight management questionnaire was developed with the help of Kaiser Permanente, which recommends 5 steps towards achieving a healthy weight.